Hi guys, we'll be starting with another important unit that is sexual jurisprudence. So this is one very important area, high yield area. You get a lot of questions from this particular section, right? And this is one area which is so favorite for a lot of question paper setters. So you get a lot of questions from this area. So this is very important. So let us start with this. To start with, let us start with the first topic, that is impotency and sterility, right? Let's start with basic terminologies, right? For a male, the first importance term, that is impotency. So this is the term specifically meant for males, wherein it is an inability for penile erection. It is an inability to achieve and maintain penile erection, right? It is not only about achieving but also about maintaining it. If the male is not able to achieve or maintain penile erection, we call it as impotency, right? See here, there is one more important term which is correspondingly used in females, that is called frigidity. What is frigidity? Frigidity is a female sexual coldness, right? Female sexual coldness. Loss of sexual arousal in a female, it is called as frigidity. Okay? Loss of sexual arousal, we call it as frigid, right? You can remember F for female, frigid, right? F for female, rigid, frigid. Okay, female sexual coldness, that is called frigidity. I told you impotency, I also told you frigidity. There is one more term that is called sterility, which can be used in both the sexes, right? Inability to beget children, right? Inability to conceive in a case of female, inability to make her conceive, right? That is for male perspective, right? This is a term which can be used for both males and females. Fine, sterility. So impotency, frigidity and sterility, three terms we have seen so far. Let us see what are the causes of impotency. See, a lot of causes are there. The first and most important cause is psychological, anxiety, fear, stress, right? So that is the most important cause. You can say most common cause of impotency, that is psychological. But if they ask you what is the most common organic cause, the most common organic cause is vasculogenic, right? Blood supply. Vasculogenic, that is the most important organic cause. We have other causes like neurological, we have congenital deformities in the penis and any other place, acquired diseases like any infections, right? A huge hydrocele, right? Malignancy. So all these conditions will be causing impotency, right? All these will be causing impotency. So let us look at another special situation wherein the man is potent to this female, is potent to this female, is potent to this female, but to this female he is impotent, right? He is impotent. He is potent to all male, a male who is potent to all women except to one particular woman, right? Impotency towards one particular female, that is called impotence quad hack. Impotence quad. He is potent to all other women. To one particular female, he is impotent. This is basically psychological, right? This is basically psychological. He is impotent. Fine. Now the question is, in general, impotency can be a ground for nullity of marriage, because marriage is a contract between male and female for the purpose of physical union, right? So when the male is impotent, that will result in non-consummation of marriage. It will result in non-consummation of marriage. That marriage can be declared null and void. Fine. So in this situation, in other cases, you can say the male is impotent to all females. So this person, the marriage can be declared null and void. But in this situation, you can see that this fellow is potent to all females except to this particular female. This particular female happens to be the wife, right? The male potent to all females except to his own wife. Can this marriage be declared null and void? Yes. Specifically, this condition, when he is impotent to one particular female, that situation, you can consider the marriage to be declared null and void. So that is again important. See, this impotence quad hank, that is a male impotent to one particular female. There is one more situation, one more terminology, that is called impotent quad hunk, wherein it is applicable for, it's a female perspective. It's a female perspective wherein the female is impotent to one particular male, right? So this is for a female. This is for a male, right? So this is for a male, and quad hunk is meant for female, wherein the female is impotent to one particular male. right? Basically, so we can see this is impotence quad hang, psychological impotency, So we have discussed all these terminologies. See, all these are the situations where there is decreased sexual desire or something. In generally what happens, sexual intercourse, male will be active partner and female will be passive agent, right? You can see active, the person, when it is when the person, active person happens to be a passive, then it is impotency. But here there are situations where there can be excessive sexual desire. There can be excessive sexual desire. If there is excessive sexual desire in males, we call this condition as satyriasis. Right? This was asked in one of your examination. Do remember, excessive sexual desire in male, it is called satyriasis. Right? Similarly, there can be excessive sexual desire in females as well. When there is excessive sexual desire in females, we call this as nymphomania. Right? This particular condition, this condition is called as nymphomania. So do remember satyriasis and nymphomania. Satyriasis is meant for male having excessive sexual desire. Nymphomania is a term which is used for females having excessive sexual desire. So do remember these two terminologies. Fine. Let's move on to another important discussion. So this is about marriage. Right? Marriage. Wherein a valid marriage is given by a section 5 of Hindu Marriage Act. You can see Hindu Marriage Act, HMA, Hindu Marriage Act. Right? Now we'll be discussing on few important terminologies. When this marriage can be declared null and void, when this marriage can be divorce, legal separation. So we'll discuss about, but before discussion on the conditions of it, before discussion of the indications of nullity and divorce, so we are going to discuss about nullity and divorce. But before discussing the indications of nullity and divorce, we need to know few important terms. We need to understand few terms. Number one, that is called null and void. Then you have what is called as voidable. Another one is divorce. What do you mean by null and void? See, nullity itself can be of two types. One is null and void, another one is voidable. What is null and void? That means it is void ab initio. Means from the beginning it has never existed at all. It never existed. You cannot consider that as a marriage at all. So it has never existed. The person is unmarried. Basically unmarried. Legally, technically unmarried. Void ab initio. Voidable means here one of the party has to apply to the court of law. One of the party has to apply to the court of law. The court will go through the case. The court will declare whether the marriage is null or not. The court will declare the marriage to be null. Divorce. Already married couple, legally married couple, asking for legal separation. When there is a legal separation, it is called divorce, wherein the partner is eligible for alimony. These voidable conditions are given by 11 and 12 of Hindu Marriage Act, section 11 and 12 of Hindu Marriage Act, whereas the indication, the condition, the eligibility for divorce is given by section 13 of Hindu Marriage Act. Just know that is for your extra knowledge, right? It's not usually asked in your examination. But let us see what are the indications where it is considered null and where it is considered voidable, and then it is divorce. We'll discuss that. That is important. Number one, it is bigamy. What do you mean by bigamy? If any of the partner is already having a living spouse, then this marriage will be considered null and void. Number two, prohibited relationship. When the marriage is between prohibited relationship, right? What is a prohibited relationship? It is between brother, sister, it is between father and daughter, it is between mother and son. All these are prohibited relationship. They can ask you what are the prohibited, under what are, if the marriage is between which of these combinations, the marriage can be declared null and void, right? Option A, mother and son. Option B, father, daughter. Option C, brother, sister. Option D, father, mother. Don't choose father and mother. That is normal, right? Then moving on to voidable conditions. Let us discuss voidable conditions wherein the party has to apply to the court of law and the court will declare. We'll see that. If, suppose, the husband was suffering from incurable impotency, right? Incurable. I told you earlier, impotency is one of the important cause of nullity of marriage because non-consummation, right? And do remember, complete penetration is necessary to say the marriage is consummated, right? There are so many instances, so many cases where the courts have given a lot of judgments, right? What you have to understand the points are: number one, complete penetration is necessary, partial penetration is not accepted as consummation of marriage. Number two, even one penetration is enough to say marriage is consummated. One act of sexual intercourse is enough to say that the marriage is consummated. And the third important thing is, inability to satisfy the partner does not mean that it is a ground for nullity. Right? Inability to satisfy the partner, that is not a ground for nullity of marriage. Impotency means it should be non-consummated, not even once, right? Not even once. The second important condition for nullity is if the person was, right? If any of the partner is suffering from incurable insanity. Because at the time of marriage, if any one of the partner is insane, the consent which they have given cannot be considered as a valid consent, so it cannot be considered a valid marriage. I told you earlier, see, if this marriage is a contract between two people, right? Marriage is a contract between two people, basically. So any of the partner, if any other person who's signing the contract is insane at the time of signing, obviously that contract is not valid. The same thing applies here as well, right? If any of the partner is insane at the time of marriage, this marriage can be voidable. And if the consent given by the person is invalid consent. When do you say the consent is invalid consent? Suppose if the consent was given by fraud, one of the partner was cheated. By means of fraudulent means, the consent was obtained. And if one of the person was forced to give consent, if the consent was given by force, or if the consent was obtained due to intoxication, right? If one or both the partners are intoxicated at the time of marriage, definitely that consent which they have given is invalid, right? So that is invalid consent. And not only that, impregnated wife, right? Wife is impregnated, not because of the husband, right? If the wife was impregnated by any other person other than the husband at the time of marriage itself, then it can be voidable marriage. Not because of husband, by someone else, right? And the last important condition is if the marriage consent was obtained due to impersonation. If the marriage consent was obtained due to impersonation, then again it is considered as voidable marriage. So you can remember everything that starts with I: impotency, insanity, invalid consent, impersonation, and impregnated wife. Impersonation, right? She is believing that she's getting married to one person, right? After getting married, she got to know that it is not the person whom she thought. It is one of the twin brother of that person whom she got married, right? Fine. So that is impersonation. Let's talk about divorce. I told you they are already legally married. Now they are getting legally separated. That is called divorce, and the partner is eligible for the alimony. Under what are the situations the spouse can apply to the court of law for divorce? Grounds for divorce. Number one. What is that? That is desertion. The partner has deserted the spouse. 2 years, at least 2 years. He is not coming to the house at all. He is not taking care. Deserting the spouse, deserting the partner, it's a ground for divorce, right? Incurable insanity, right? After marriage, the person become insane, suffering from incurable insanity. That is again a ground for divorce. Venereal disease, incurable, right? HIV and all, it's a ground for divorce. Offenses. Suppose if one of the partner is convicted, particularly if the husband is convicted of rape or bestiality, right? The wife can apply to the court of law for divorce. Okay? And you can say renunciation. He has renounced the world. Renunciation. He has renounced the world. I don't like this material world. I want to become a god man. I want to become a sadhu, saint. right? So he is renounced the world. That itself is a ground for divorce. Religion change. Earlier he belongs to one religion, but after getting married, without the consent of the spouse, without the consent of the partner, he is changing his religion, converting his religion, religious conversion. Right? That's a ground for divorce. Right? Cruelty. When I say cruelty, do remember it is not only physical cruelty, it can also be a mental cruelty. It can be a physical cruelty or mental cruelty. Both will amount to the divorce, right? Both will be amounting the ground for divorce. It is physical or mental, right? And do remember there are many instances where the courts have told that abstinence of sex, it's a form of mental cruelty. That's why you can say even frigidity of a female itself is the form of mental cruelty that can even be considered as a ground for divorce, right? Abstinence of sex. And then the last one, you can see extramarital affair. What is that extramarital affair? That is basically adultery. Right? That is basically adultery. Adultery, that may not be a punishable criminal offense, but do remember that is a ground for civil cases, particularly divorce case. Right? When the partner is involved in adultery, the another spouse can apply for divorce in the court of law. Right? So do remember all these situations for the grounds of divorce. I have given you, listed it very, very carefully so that you will understand it properly. Right? Have you noticed that I have given you in the form of divorce itself? D-I-V-O-R-C-E. You just remember divorce, you will be able to remember the grounds for divorce. Right? Very simple. You can easily remember. I told you null and void, voidable and divorce. Grounds for divorce. These are all the questions that you can get. Right? In nullity and divorce. So I've told you all these grounds for divorce and voidable marriage. Let us see few examples cases. Twin sister. This is one case, very special case, very interesting case where twin sisters who wanted to get married to only one man, who wanted to go to one family. So they convinced the man, they have convinced the groom actually, they convinced the both side families, and both of them, they got it married to the same man, the same day, everything is done. And this news that came in the videos, like in many news medias and all, it was published. But what happened few days later, right? Just like few moments later, this few days later, what happened? This person was booked by the police for the offense of bigamy, right? I told you, bigamy should not be there. So this person was arrested for charged for bigamy. Newly wed bride found 4 months pregnant by the husband, right? He got to know that the bride was 4 months pregnant at the time of marriage itself, right? Fine. And I told you that if the bride is impregnated already at the time of marriage, that itself is a ground for voidable marriage. Voidable. Right? So this is another thing that I told you, abstinence of sex. It's a form of mental cruelty, right? This is given by the Supreme Court judgment. I told you the abstinence of sex is a form of mental cruelty. So frigidity can be a ground for divorce. Frigidity can be a ground for divorce. Fine. So let us see another important situation. Can a pregnant female apply for nullity of marriage due to impotency of the husband? Read the question very carefully, right? Can a pregnant female apply for nullity of marriage due to impotency of the husband? Then you can ask me, sir, when the person is impotent, how can she become pregnant? You don't think of extramarital affair, not adultery. The child is, this person is the biological father of the child. Right? How is it possible? Is it possible that the female getting pregnant even without consummation of marriage? Even without consummation of marriage, that is important. There is a condition called fecundation ab extra, wherein there can be fertilization of the ova, there can be fertilization of the ovum in a female even when the semen is deposited in the vulva or sometimes even in the upper part of the thigh also. Right? Very rare situation where the semen is deposited in the upper aspect of the vulva, outer aspect of the vulva, the spermatozoa will travel, go to the uterus, it will travel into the uterus, it will fertilize, right? It will fertilize. That's called fecundation ab extra. So very, very rare condition, right? See, that means, what does it mean? What does it mean? Just because a female is pregnant does not mean the marriage got consummated. That is very important. does not mean the marriage got consummated. There are various cases which have been filed like this with this particular rare condition, and still the husband was subjected to medical investigation. If the husband was found to be impotent, and then the nullity can be granted, right? The marriage can be granted voidable, right? This is called fecundation ab extra. Now we'll be moving on to one more important thing, that is called assisted reproduction techniques. Assisted reproduction technique. You are assisting reproduction techniques, right? Basically, you have got artificial insemination, right, and surrogacy. Surrogacy is otherwise called as womb leasing. Surrogacy is called as womb leasing. We'll discuss about surrogacy in detail. Now let's focus on artificial insemination. This artificial insemination can be intrauterine insemination or in vitro fertilization, right? The fertilization can happen outside, in vitro fertilization, or you are introducing semen into the uterus itself so that the fertilization can happen. That's called intrauterine insemination. But in in vitro fertilization, there are a lot of techniques. So many techniques are there. Embryo transfer, so you do the fertilization outside, transfer the embryo, or you can do what is called as gamete intrafallopian transfer, zygote intrafallopian transfer, right? EC intracytoplasmic sperm injection. All these techniques are there. A lot of techniques are there. But here we'll be focusing on what is called as intrauterine insemination. Let's discuss about that. What is basically artificial insemination, intrauterine insemination, where it is an artificial introduction of the semen into the female genital tract to produce pregnancy. It's called as artificial insemination. Artificial insemination. Let us see what are the indications for this procedure. What are the indications for this procedure, right? The first type of indication, let us say conditions like in males having conditions like erectile dysfunction, right? Erectile dysfunction, congenital defects, when there is reduced sperm count, only mild case, not major severe case, mild reduction of the sperm count, or in females having vaginitis, cervicitis, or cervical stenosis. In all these situations, what can you notice is the person is unable to deposit spermatozoa, right? The person is unable to deposit spermatozoa in the female genital tract. All these conditions is where you can do artificial insemination. These are the indications wherein you can use the semen from the husband himself. When you can use a semen from the husband itself, that is called AIH. What is that called? Artificial insemination homologous or artificial insemination husband. You are using the semen of the husband, right? The sperm quantity is fine, the sperm quality is fine, but he is unable to deposit. There is some problem with the deposition of semen into the female genital tract, either from the male side or from the female side. Male side, there is erectile dysfunction, congenital defect, or you can say reduction in the sperm count, mild, right? Or if it is female, there is vaginitis, cervicitis, there are a lot of antibodies there, anti-sperm antibodies, where this deposition does not happen. For that, you can have what is called as artificial insemination homologous, where you introduce the spermatozoa directly into the female genital tract, right? There are other set of conditions where if the husband is completely sterile, if there is any hereditary disease, or if there is any RS incompatibility, or if there is a widow, right, opting for this pregnancy, right? In all these situations, you cannot use the semen of the husband. Here is where you need to use the semen of the donor. When you're going to use the semen of the donor, this type of artificial insemination is called artificial insemination donor, AID, or artificial insemination donor. If you're going to use the husband semen, artificial insemination husband. If you're going to use the husband semen of the donor, it is called artificial insemination donor, as clear as that. Now let us talk about consent. If you are doing artificial insemination husband homologous, in this stage, you need to get the consent of the husband. You should also get the consent of the wife both, right? Consent is mandatory from both husband and wife, right? Husband and wife. Suppose if you are preferring artificial insemination donor, you need to get the consent of the recipient couple, that is husband and wife. You should also get the consent of the donor and the donor's wife, right? All these people's consent is mandatory. You need to get the consent of the donor and the wife and the recipient couple. Now, while you are selecting donor, is there any criteria that what you should look for in a donor to select? right? See, first of all, the donor should be a married person and he should be having healthy children. At least one healthy child should be there, right? One healthy child should be there. So that is one important criteria. There should not be any kind of RS incompatibility. Right? There should not be any kind of RS incompatibility. Ideally, the donor should be unrelated to the couple so that there is no any consanguinity appearing. And do also remember the person should be less than 40 years of age and preferably same race. Right? You cannot use the semen of the Negroid person to the Asian person or Indian person. Right? It will lead to disastrous consequences. Fine. Okay, fine. See, if the recipient couple prefers to have it, right, then it can be done. Otherwise, it is preferably to be of the same race, right? Ideally from the same region. Okay, so the donor should be married, healthy child, should be having healthy child, less than 40 years, right? And no RS incompatibility. There should not be any kind of genetic disease and preferably from the same race. What is the medico-legal importance? Right? First one is nullity and divorce. What is a nullity? I told you earlier, if the artificial insemination is due to impotency of the husband, you know very well, impotency is a ground for nullity of marriage, right? Non-consummation. Divorce. If the artificial insemination procedure has occurred, right? The procedure has occurred without the consent of the husband, right? Without the consent of the husband, then the husband can file for a divorce in the court of law without the consent of the husband. Ideally, both the husband and the wife's consent should be there. But some cases where if the husband consent is not there, wife has undergone artificial insemination even without the consent of the husband, then that is a ground for divorce. Husband can file a case of divorce in the court of law. Right? Legitimacy. As per the latest Assisted Reproductive Technology Act, the child born out of these techniques are legitimate child. They are considered to be the biological child of the couple, right? Legitimate. And adultery. Can you say this amount to adultery? When you introduce the semen of the donor into the recipient wife, can you say this is adultery? No, it cannot be adultery because there is no physical union. For you to say it amounts to condition of adultery, there should be a physical union. In this case, there is no physical union, so this cannot be considered as condition of adultery, right? Fine. And then you have incest. What is it? There is a remote chance of incest. It's a very remote risk. There is a remote risk of incest where the child of the donor and the child of the recipient couple, right, both having sexual intercourse. That may be a very rare remote possibility. That's a remote risk of incest for this condition. And sometimes there can be litigation for the doctors as well. Why? If suppose the child which is born is defective, right? The child which is born is defective. Sometimes the recipient couple, right, can sue the doctor, can file the case against the doctor. Okay, so that is also possible, right, in this situation. So these are all the different medico-legal importances that you need to know with regard to artificial insemination. There is one more important condition that is called surrogacy. First of all, here we need to discuss something in detail about Surrogacy Regulation Act 2021. Who's a surrogate first of all? I told you earlier, surrogacy is something called womb leasing. You are renting the uterus. Who's a surrogate? Surrogate is a mother who by contract agrees to bear the child for someone else. After the delivery, the child will be handed over to the recipient couple. So let us look at the types of surrogacy. What are the different types of surrogacy? Number one, it is called commercial surrogacy. Commercial. Another one is altruistic surrogacy. Commercial surrogacy. Another one is altruistic surrogacy. Commercial surrogacy is basically the child is born. It is done. This kind of procedure is done for money, monetary compensation. Right? This is for monetary compensation, money. Whereas altruistic surrogacy is not done for money. It is done out of love and affection. Right? If they are close relative, they are so affectionate to you. For the recipient couple, that close relative is ready to bear the child for that particular couple. Out of love and surrogacy, there is no money involvement in this. There is no monetary involvement in this, right? But here the hospital expenses and the insurance expenses have to be, hospital expenses and the insurance expenses should be taken care by the intending couple, right? Excluding hospital and insurance expenses, they should be taken care by the intending couple. Intending couple is the couple that who intends to have the baby. Fine. Now let us see what are the different aspects of surrogacy regulation bill, right? It specifies the eligibility for the intending couple, the eligibility criteria for the surrogacy mother, and what are the medical ill aspects of the child which is born out of it. Let us discuss about it. Here, let us say intending couple. The intending couple should be married, right? Married, definitely married. Indian, they should be belonging to India. NRIs cannot opt for surrogacy. NRIs cannot opt for surrogacy. Only Indian married couple can opt for surrogacy, right? Even widows and divorcees can opt for this procedure, right? And they should be having a proven, they should be, they are married, right? They should be married at least for 5 years, and they should be having proven infertility. Proven infertility, right? As I told you, NRIs cannot opt for this, right? Other live-in couple cannot opt for this. Live-in couple cannot opt for this. The next situation is, what is the eligibility for being a surrogate mother? If a woman wants to be a surrogate mother for this intending couple, what are the eligibility that are needed? Number one, she should be a very close relative, right? Obviously, she should be married and she should be having at least one child, one healthy child, at least one healthy child. And the age, right? The age between 25 to 35 years, and throughout her lifetime, she can be a surrogate only once in her lifetime, right? Earlier it was thrice as per ICMR regulations, but there was some controversy about that. But now it is very clear that as per this act, only once a woman can be a surrogate mother, right? She should be a close relative, she should be married, and should be having at least one child, right? One husband at least. So married basically, right? 25 to 35 years, only once. Everything is one. Right? Now, what about the child? The child born out of this procedure. The child born out of this procedure is considered as the legitimate child or not? Of course, right? Legitimate, absolutely legitimate. This child will be considered to be the biological child of the intending couple, not with regard to surrogate mother. This child is considered to be the biological child of the intending couple. And do remember, there is absolutely no sex selection permitted in this. Sex selection is not permitted. And also do remember, if somebody abandons a child, if the intending couple abandons a child, this abandonment is considered very serious and it is legally punishable. Abandonment of the child is legally punishable. Right? Very important. Sometimes the child is born out of surrogacy and the intending couple does not somehow, for some reason, they are not interested to have this child and they are abandoning the child. It is punishable legally. It's a crime. It is a crime. So here you can see that the husband is there, wife is there, donor is also there, surrogate mother is also there. Right? You can take semen from the husband, spermatozoa from the husband, ovum from the wife. You can keep it in the surrogate mother. That is possible, right? Husband, wife, you can keep it in the surrogate mother. If the husband is not having, if the spermatozoa of the husband cannot be used, you can take spermatozoa from the donor, use a ovum from the wife, you can keep it in the surrogate mother. Or if that can also not be used, the donor semen and the surrogate mother ovum can be used and it is fertilized and that will be used for the child. Okay, so all these combinations can be done depending on case-to-case basis. That is important, depending on case-to-case basis. So these are the important points that you need to know with regard to Surrogacy Regulation Bill, Surrogacy Regulation Act. It has become an act. But So far, I have not told you one important thing. Do remember, I told you two types of surrogacy, right? One is commercial and another one is altruistic, which is permitted as per the Act. Do remember, the commercial surrogacy is not permitted. Only one thing is permitted, that is altruistic surrogacy is permitted as per the Surrogacy Regulation Act. As per the Surrogacy Regulation Act, only altruistic surrogacy is permitted. Commercial surrogacy is totally prohibited in India, right? That is highly important for you to learn. So let us look at the next important chapter, that is virginity. We'll talk about virginity. Let us learn with few important terminologies. Apta viro. What is that? Here, this term states that the female is fit for marriage. Apta viro. Fit for marriage or fit for husband or fit for procreation, right? Everything means the same thing, right? Apta viro. Another term, virgin. Who's a virgin? It's a female who has not experienced sexual intercourse. That's virgin, right? It's a female who has not experienced sexual intercourse. Defloration, loss of virginity, that is called defloration, right? Loss of virginity, that is called defloration. Only once. First time, it's called as deflorated, right? First time, that is called deflorated. Defloration, virginity and defloration. That is very important. Now, let us see what are the important signs of virginity. So, let us see something about hymen, right? What is basically a hymen? Hymen is basically a fold of mucous membrane in the vaginal orifice. It's a fold of mucous membrane, right? It's it has got very narrow opening. You see, depends on the age of the child. For a girl of 10 years old, it can admit only the tip of the little finger. For a female at puberty, it can admit one finger into it, right? That is hymen. We have lot of types of hymen. Let us learn about the different types of hymen, right? First one, you can say annular. We have semilunar. We have septate. We have cribriform, right? We have what is called as imperforate, completely closed. It's not open at all, right? Right. And one more, that is your fimbriate hymen. You have lot of other types of hymen, dentate hymen, so many things are there, but these are all the most common, most important types for medico-legal purposes, right? Out of all these things, which is most common hymen? The most common hymen is semilunar hymen, right? And the most important one for our MCQ purposes is fimbriate hymen. I'll show you that, fimbriate hymen. You can see these are all the different types of hymen. This is basically annular. You can see annular hymen. What is this? This is your semilunar hymen. I told you this is the most common hymen. What is this? Septate hymen. This was asked in your last year examination as well. This is septate hymen. And you can see this is cribriform hymen, where you can see sieve-like openings. When it is completely closed, you call it as imperforate. And what is this? This is your fimbriate hymen. This is again very, very important, right? Fimbriate hymen. You can see there are a lot of notches. There are a lot of notches are there. But the point is, suppose if your medical officer examining this particular girl, woman, right, who has got fimbriate hymen, there are a lot of chances that this fimbriate hymen notch may be mistaken for hymenal tear. It may be mistaken for hymenal tear. That is very important. Hymenal tear, right? Particularly if the medical officer is inexperienced and doesn't know about the type of fimbriate hymen, right? This can be thought as hymenal tear. Do remember, this is not a tear. This is a normal anatomical variant of hymen. This is a normal anatomical variant, right? This is highly, highly important. But how to differentiate between hymenal tear and fimbriate hymen, I'll tell you. I'll tell you that. Let us go forward. We have seen the different types of hymen. What are the causes of hymenal rupture? What are the causes of hymenal rupture? The most important cause of sexual intercourse is one, the most important cause. Masturbation, that is again very important cause. Accident, any kind of accident, right? Any surgeries, any foreign body insertion like the solar pith, right? They used to keep the solar pith inside. By absorbing moisture, it will expand. It will cause opening of the hymen, the rupture of hymen. Right? So these are all the different causes of hymenal rupture. These are all the different causes of hymenal rupture. Horse riding and all does not cause hymenal rupture and all. Right? So let us see this one. This is the hymen. Suppose in case if there is any penile penetration, right? You can also note the different location of the hymen, right? 12 o'clock, 3 o'clock, 6 o'clock, 7 o'clock, you can see all these things. If there is any penile penetration, the most common site of hymenal tear, the most common site of hymenal tear is posterolateral. Usually the tear due to penile penetration will happen somewhere between 4 o'clock to 7 o'clock, right? You can remember it is between 4 o'clock to 7 o'clock. 4 to 7. You can see the hymen, which is hymenal tear, which is present near somewhere close to the 7 o'clock. Definitely you can say this should be due to penile penetration. Penile penetration. On the converse, suppose if it is due to digital penetration, if it is due to digital insertion or foreign body insertion as in masturbation, where in that case the position, the location of the hymenal tear, it is not posterior, posterolateral, it is anterior, somewhere here, right? Somewhere here, anterior. Right? By looking at the location of hymenal tear itself, you can assume that what could be the cause, whether it's due to penile penetration or not. Right? So posterior, posterolateral, penile penetration, anterior, that is digital penetration. But sometimes what happens, in spite of sexual intercourse, the hymen would be intact. Even after sexual intercourse, hymen would be intact. Why? Because there are two important reasons. One, it may be a child. Number two, she may be a false virgin. Right? She may be a false virgin. If the person happens to be a female child, in child what happens? The hymen is deep seated. If the hymen is deep seated, it will not rupture. That is one important question. False virgin. In false virgin, who is a false virgin? The false virgin is a female who has had sexual intercourse, but still there is intact hymen. She has got intact hymen in spite of sexual intercourse. Why is it like that? Because the hymen might be too thicker. It will not rupture. It might be too elastic. It will not rupture. Or if it is too loose, again it will not rupture. Right? Fine. So these are the two situations where the hymen is intact in spite of sexual intercourse. One is child, you have deep-seated hymen. Another one is false virgin. Right? Too thicker hymen, too elastic hymen, and if it is too loose hymen, hymen will not rupture at all. Hymen will not rupture at all. Fine, let's go forward. I told you this is your hymenal tear. Right? This is the tear. And this is fimbriate hymen. I told you sometimes you can get confused whether it is fimbriate hymen or it is hymenal tear. How to find it out? How to find it out? So let us see that. Let us see that, guys. See, if it is hymenal tear, that is a normal anatomical variant that is usually symmetrical. You can see symmetrical notches. Symmetrical notches will be there. Right? Whereas hymenal tear, it is not symmetrical, it is asymmetrical. Right? And you also need to note that if it is hymenal, that is fimbriate hymen, if it is hymenal notch, we need to call it as notch. Right? If it is hymenal notch, what you can see is it does not extend to the margin. It does not extend to the margin. You see here, it is not extended to the margin. Now you see the hymenal tear is extending up to the margin. Right? Not up to the margin. Right? If it is notch, it is not extending up to the margins. Right? Whereas if it is hymenal tear, it is extending up to the margin. Up to the margin. And of course, when you examine the hymenal tear, you can see that the congested bleeding will be there. And when you look at the margins of the tear, you can find out that the mucosa is torn. Whereas here, the mucosa is intact. Mucosa is intact because this is basically a notch, hymenal notch. Right? Fine. So these are all the differences by which you can find out whether it is fimbriate hymen or it is hymenal tear. This is very, very important for practical purposes. This is very important for practical purposes. I told you that you need to see the margin of the hymenal tear. You need to see the edge of it. All these things you need to see. But how will you see? How will you see? For that, what you can use is you can use what is called as Glaser keen rod. Glaser keen rod. This rod will be having, right, luminescent bulb will be there. Right, you can see bulb will be there. That will illuminate. You can see. You just need to insert inside. Just slowly you need to retract. From on the bulb, you can see the margins of the tear. right? With that, you can find out the margins. You can examine the margins. One more terminology that we have to know, that is called Carunculae. Carunculae myrtiformis. Right? Myrtiformis. It is basically the remnants of hymen. Right? Hymenal remnants will be like a round nodule or something in the vaginal orifice postpartum, particularly after sexual exposure, also childbirth, right? Hymenal remnants, right? Post childbirth. We call this as Carunculae myrtiformis. Carunculae myrtiformis, right? They are basically remnants of hymen. See, we discussed about the different types of hymen and everything, but now I'll tell you what are the signs of virginity. What are the signs of virginity? Let's discuss about that. See, the first and foremost important sign is intact hymen. Intact hymen is the most important sign. But do remember, intact hymen suggests that she is virgin, but doesn't mean that if the rupture of hymen means she is deflorated. It is not so. Right? Because we have already learned that the hymen can get ruptured due to a lot of other conditions apart from the penile penetration, apart from the sexual intercourse. There are a lot of other causes wherein the rupture of hymen can happen. Right? If the hymen is intact, it is suggestive of virginity. Fine. The next important point is intact fossa navicularis and posterior commission. Intact fossa navicularis and posterior commission again will be suggestive of virginity. And the most important point is you can say narrow vagina with intact vaginal rugosity. So that is again very important. We can say narrow vagina with mucosal rugosity. That will again strongly suggest that she is virgin. Mucosal rugosity. Right? So that is again very, very important. If you look at these things, see in the book that you could have seen like lot of other findings which are suggestive of virginity. Signs of defloration, signs of virginity, you must have seen lot of findings. You can say starting from labia majora, minora, breast changes, so many things are there. But these are all the most important, most relevant points that you have to know. Right? When you talk about the hymen, so suppose if there is first intercourse, right, we know it is defloration. If it is first intercourse, loss of virginity, you can see rupture of hymen. But now the point is this narrow vagina, this mucosal rugosity. This mucosal rugosity does not disappear even with one episode of sexual intercourse. Not like only when the female is exposed to prolonged sexual activity, repeated sexual activity, then this rugosity will be lost. Right? If the mucosal rugosity is lost, loss of mucosal rugosity. When there is loss of mucosal rugosity, then we can say that this woman is exposed to repeated sexual intercourse. Right? Or you can say she is exposed to repeated sexual activity. Right? Only when there is continuous, mucosal rugosity will not be lost with one intercourse itself. You need continuous repeated friction. You need to have repeated sexual intercourse for this kind of mucosal rugosity to be lost. Right? So the presence or absence of mucosal rugosity will be telling us whether she is exposed to repeated sexual activity or not. Okay, so that is a point that you have to remember. Do remember the signs of virginity. Right? Going forward, let us talk about pregnancy. Right? We have spoken about virginity. We have spoken about defloration. Now the next thing is pregnancy. We'll talk about the signs of pregnancy. Right? See, when we take the signs of pregnancy, you must have learnt about a list of signs of pregnancy. But all this list can be categorized into three main categories. Number one, presumptive signs, probable signs, and positive signs. Presumptive signs of pregnancy, they are least predictive of pregnancy. Right? But whereas positive signs of pregnancy, they are absolute evidence of pregnancy, that is confirmatory sign. Definitely 100% that female is pregnant. Right? What are the signs that will be categorized as presumptive, probable, and positive? Let us learn that. Presumptive sign, you can say amenorrhea. You know there are n number of causes, reasons for amenorrhea, right? Morning sickness, not only seen with pregnancy, it can be seen in any condition where there is excess is HCG, right? You can see abdominal enlargement, not only fetus, fat, flatus, you have fluid, so many things are there. The reason for abdominal enlargement, increased urinary frequency, breast changes, pigmentation of the skin, quickening, all these are presumptive signs. Least suggestive of pregnancy. Probable sign. right? You have what is called a Goodell sign, you have Hegar sign, Braxton Hicks contractions, and bellotment, internal, external, positive HCG test. That is again important. You can ask me, sir, positive HCG test, that is a positive sign of pregnancy, right? Positive HCG test, is it a positive sign of pregnancy? No, HCG is positive, but that is not the positive sign. That is only probable sign. That is because HCG is not elevated only during pregnancy. There are few other conditions wherein you have choriocarcinoma, you have placental tumors wherein this HCG will get elevated. HCG test may be positive in that situation. So HCG, urine pregnancy test, that is not a confirmatory test of pregnancy. Now, what are the confirmatory signs of pregnancy? That is important for your examination, right? Let us discuss about that. So what are the positive signs of pregnancy? What are the confirmatory signs of pregnancy? If this sign is there, guys, definitely 100% she is pregnant. So we'll discuss about that. Number one, it is the palpation of fetal movements, right? Palpation of fetal parts. It is not the fetal movement perceived by the mother. No, it is you, the doctor. When you examine the baby, you are able to palpate the fetal part, and when you are able to palpate the fetal movement, then you can say she is pregnant, 100%. And auscultation of the fetal heart sound, that is again one of the positive sign. Then you can do investigations like radiograph, or you can do ultrasonography, which will confirm the presence of fetus inside the uterus, right? So these are only confirmatory signs of pregnancy or positive signs of pregnancy. Confirmatory sign, right? Suppose if you take X-ray, normally we don't take in a live people. Suppose if you take X-ray, what are the findings that you can notice? You can see a series of small dots linearly, right? You can see crescentic shadow. You can see the vertebral shadow, right? Crescentic shadow suggestive of skull. Series of curved parallel line, that is ribs. You can see the ribs. And you will also find linear shadow suggestive of the limbs. So all these shadows are there. It is nothing but fetus only, right? Confirmation, right? More appropriately, you take ultrasonogram, you'll be able to find out the fetus. So why should we know this positive sign of pregnancy? There is a condition called phantom pregnancy, which is also called as pseudocesis. Cesis means pregnancy, pseudo means false. It's basically false pregnancy. It is also called as spurious pregnancy. It is called spurious pregnancy. It is called phantom pregnancy. It is called pseudocesis. So you have a lot of synonyms. All these are synonyms basically. In this condition is where the female believes she is pregnant. The female, she believes she is pregnant. But why she is believing she is pregnant? That is because she has got abdominal distension. She has got morning sickness. She has got amenorrhea. She is also perceiving some kind of fetal movements. So all these findings are there. She can find out that she is pregnant. Okay, fine. Now the point is, suppose if this female comes to medical attention, you are the doctor, right? She comes to your medical attention, she comes to your care. Fine. You are going to examine her, you're going to ask the history. She's telling that abdominal is distended and there is, I can feel the morning sickness, I can see breast enlargement is there, abdominal enlargement is there, everything is enlarged, so definitely I am pregnant, right? And you're going to examine her. When you examine her, you can see that all the subjective signs are there, right? All the subjective signs and all the subjective symptoms are there. But when you examine what is not there, it is the positive signs that is not present. Positive sign of pregnancy absent. Right? I told you what are the positive signs of pregnancy. When you palpate, no fetal part. When you palpate, no fetal movement. When you auscultate, no fetal heart sound. Nothing is there, right? All the subjective symptoms are there, but no positive sign. You got a doubt whether she is actually pregnant or not, right? She happens to be a childless female. Who's nearing menopause. She is having intense desire to have a child. She's intensely desiring to have a child, and she is presenting with all these features. You got a doubt whether she is pregnant or not. You take ultrasonogram. Ultrasonogram shows the uterus is empty. There is empty uterus, right? Uterus happens to be empty. There is no fetus inside. You make a diagnosis, you confirm that it is phantom pregnancy, you can send it to psychiatrist for counseling purposes, right? In case if she has come to medical attention, which normally happens nowadays, like there is no female who doesn't have any kind of medical attention with pregnancy. But in case if there is no medical attention, if there is no medical attention, what happens? This kind of scenario, when there is no medical attention, this can progress into labor also. This can progress to full term pregnancy. Sometime it may advance to full term. It may advance to full term, right? They may have false labor pain also. They may have false labor pain. They'll keep on straining, but no fetus coming out because there is no fetus inside. There is no fetus inside when there is no medical attention. But the kind of situation is very, very rare. She is not pregnant. What is the reason for abdominal distension? What is the reason for amenorrhea? What is the reason for morning sickness? What is the reason for all these things? All this is due to hormonal disturbance. All this is due to hormonal disturbance. What is the reason for abdominal distension? Abdominal distension is not due to fetus, it is due to fat. Right? It is due to fat getting deposited. It is getting fat getting deposited. That is why you are able to see the abdomen enlarged. Right? This condition is called as phantom pregnancy, spurious pregnancy, or she thinks that there is fetus inside, there is no fetus inside. When you take ultrasonogram, the uterus happens to be empty. Right? Uterus happens to be empty. Now let's talk about twin pregnancy. Let's talk about twin pregnancy, wherein we have to learn about two important conditions. Number one, it is called superfecundation. Right? Number two, it is called superfetation. We have superfecundation, we also have superfetation. In both these conditions, what happens is there is fertilization of two ova. Fertilization of two ova. Same thing. But the timing differs. You can see that the fertilization of two ova occurring in the same cycle, right? Same ovulatory cycle, then you can call it as superfecundation. How can you remember? You can remember S for same cycle, C for cycle. Superfecundation, same cycle. Fertilization of two ova in the same cycle by two different act of coitus. That is very important. Two different act of coitus in a short interval. In a very short interval. Maybe by the same male or by the different male. If it is done by the same male, you call it as monopaternal. Same fellow. Monopaternal. Same father. Right? Or if it is by different person, right, you can call it as bipaternal, sometimes multipaternal, right? You call it as heteropaternal, different father, right? Heteropaternal superfecundation, right? Monopaternal, it's fine, same father, but heteropaternal, two different fathers, may be a case of adultery, right? Same cycle by two different act of coitus. Fertilization of two ova in two different ovulatory cycle. Then you call it a superfetation. Fertilization of ova in a female who's already pregnant. She is already pregnant. One more ova is also getting fertilized. One more ovum is also getting fertilized. That is called superfetation. You call it a superfetus. One over the other. Right? Superfetus. One over the other. Fertilization of ova in a female who's already pregnant. Technically, logically speaking, once a female becomes pregnant, there should be an ovulation. But in very rare situations that a female can ovulate, that ovum will also get fertilized in the next cycle. Very rare condition. Rarest of rare condition, very commonly seen with animals, not with human beings. Right? In superfecundation, what you can see is there are two fetuses will be there because two ova got fertilized, two fetus will be there. Both will be of same age and same development. But when it comes to superfetation, what happens? Both will be at different age and different development. Different age, different development. But sometimes what happens if there is twin pregnancy, when one fetus is getting grown, it may compress another fetus. Right? It may compress another fetus. It may result in what is called as fetus preparaceous. Fetus preparaceous or fetus compresses. Right? That can happen. right? But now technically what you have to know is superfecundation, superfetation. If it is in the same cycle, fecundation, different cycle, fetation. Same cycle means so both will be of same growth, as different cycle, superfetation, different growth, different age, right? You can see that this is your superfecundation, right? You can see one father should be a black male, another father should be a white male. This should be a case of heteropaternal superfecundation, heteropaternal, right? There are a lot of cases, though it is rare, a lot of cases are being reported. You can see mother gives birth to twins with different fathers, right? This is another case of superfecundation, right? You can see this is another case of superfecundation. You can see the babies should be heteropaternal, okay? And now this is superfetation. This is superfetation, wherein extremely rare case wherein the woman gets pregnant while she is already pregnant. I told you, fertilization over. She gets pregnant while she is already pregnant. Pregnancy over pregnancy. Right? Fetus over fetus. This is your superfetation. You can see that one baby is bigger in development, another baby is smaller in development. Right? Fine. Now let us look at the some more few important definitions. Right? What are the definitions that we have to know? Who is a legitimate child? A legitimate child is one who's born during the continuation of lawful marriage. It should be a lawful marriage, during the continuation of lawful marriage, or within 280 days of separation. 280 days of separation may be due to death or may be due to divorce. Separation means it can be anything, right? So it may be death or divorce of the partner, right? Provided the female is not married to somebody else, right? If she is married to somebody else, then you can't say it is legitimate, right? Legitimate child is the child which is born out of a continuation of lawful marriage or within 280 days of separation when the wife remains unmarried, right? Suppose if this criteria does not satisfy, you can call the child as an illegitimate child, or they commonly call it as bastard, right? Illegitimate child, right? You can say the child born out of lawful wedlock. That is called illegitimate child, right? But normally I told you, right, within 280 days of separation, the husband died, within 280 days of separation, the child has to born, legitimate. What if, is there a situation where the husband is dead, the mother gives birth to a child after 280 days, but still the dead father is the biological father of the child, right? Is there any possibility? Yes, there is a possibility, provided if the semen of the husband is frozen and preserved, and that is used by the female for artificial insemination, then you can say that kind of situation. Okay, that kind of situation is possible in that situation, right? Now, affiliation case. Now, a pregnant female is alleging one person to be the father of her child. That is called affiliation. What is that affiliation? Female alleging a particular man to be the father of the child and asking for fixing paternity. She files a case and she is asking for fixing the paternity who happens to be the father of this child, right? She is alleging one man to be the father of the child. That's called affiliation case, right? That is affiliation. Now, what happens? Supposititious child. It was asked in one of your previous examination as well. You can need to know it is otherwise called as fictitious child. This was a term asked in your examination. It was fictitious child. It is called supposititious child. It is called substituted child, also called as forged child. Here what happens? The female does not give delivery to the baby. That's why it is called forged, or it is supposititious, fictitious. Here the female, she pretends pregnancy, and after some time she produces a child claiming that it is her own child, right? She is pretending a pregnancy. After a few months she disappears from that area. After a few months she comes with the baby and she is telling that it is I have given birth to this baby, this is my baby, you are the father, give me money, for blackmailing, right? Or sometimes it is for increasing the compensation. If the husband died to something else, for increasing the compensation, she will claim that this is my baby and the dead father is the biological father of the child, so I need more compensation, Basically, it is not her child. She might have kidnapped the child from maternity hospital. She might have kidnapped the child from someone else, somewhere else, or she might have substituted boy for girl, girl for boy, something like that. It is not her baby. Basically, that is called supposititious child. Posthumous child. That's a post means after. Humus means death. Post means after. Humus means death. It is a child born after the death. Right? Literally, child born after the death. So medico-legally, it is a child born after the death of alleged father. Right? The alleged father is alleged to be the biological father of the child. Right? Child born after the death of alleged father. It's called posthumous child. This may be important for fixing paternity. This may be a case of disputed paternity. If the husband died, right, after a few months, if the wife gives birth to a baby, it may be a case of disputed paternity wherein the paternity has to be fixed. Paternity has to be fixed. Suppose if the child is born after 10 months of the death of the father, definitely the dead father is not the biological father of the child. There is no doubt. There is no doubt. Okay, that is called posthumous child. Atavism. Atavis. The word atavis, it means ancestor. Right? So you are inheriting ancestral characters in you. Ancestral characters in you. The word atavis means ancestor. Here, the child does not resemble the parent. The child does not resemble the parent. Then whom the child resemble? The child resembling grandparents. I told you, you are inheriting the characters of the grandparents. Right? It is due to genetic transmission. That's called atavism. Child resembling grandparents. It is called atavis or atavism. Atavism. Fine. Now let us discuss about the different types of lochia. First, we need to know what is lochia. You know, lochia is a sign of recent delivery. Right? It's a vaginal discharge. You know, it is a sign of recent delivery, not a remote delivery. There are a lot of types of lochia, right? 3 important types of lochia are there. Number 1, lochia rubra. Right? Lochia alba and lochia serosa. Remember, lochia rubra, lochia serosa, and then you have lochia alba. Lochia rubra, lochia serosa, and you also have lochia alba. This is a sequence. They can ask you the order of lochia. You need to remember rubra, serosa, alba. The rubra will maybe around 4 to 5 days. Then the next 4 to 5 days will be serosa, and after 9 days you will be having lochia alba. How to remember the order? How can you remember the order? You can remember Republic of South Africa. Republic of South Africa, RSA. What is that? RSA. R for rubra, S for serosa, and A for alba. That is what you can remember. That's how you can remember rubra, serosa, alba. Right? And what about the medico-legal importance of that pregnancy? The one of the most important medico-legal importance is 416 CRPC. We discussed it earlier when we were discussing about the powers of criminal code. I told you when any pregnant female is given death sentence, the death sentence, High Court has got the power to either postpone the death sentence or commute the death sentence into life imprisonment. That is given by 416 CRPC. Right? Death sentence of a pregnant female. Either it is postponed or better it is commuted, and this High Court is having the power. Right? So do remember, this is 416 CRPC. We have discussed it earlier. We have discussed this earlier. So we'll move on to another important discussion, that is called abortion. This is yet another important discussion. We call it as abortion. You get a lot of questions from this. We'll discuss about that. See, medically, the definition of abortion is different. Legally, the definition of abortion is different. You can see, legally, the abortion is defined as expulsion of the products of conception any time before delivery. Right? Underline the word anytime. Right? Anytime. But when you see, let us assume that this is the duration of pregnancy. This is the delivery period, or you can say term. This is 28 weeks of pregnancy. 28 weeks of pregnancy. Normally, medically, what you say, it is medically the expulsion of the products of conception before the period of viability. You can say this is medical abortion. But legally, what it says is the entire period is called legal abortion any time before delivery. The entire thing is called as legal abortion. Entire thing is called as legal. Legally, the abortion is defined as the expulsion of the products of consumption any time before the full delivery, full term. Okay. Now, what are the different types of abortion? You can say it is spontaneous abortion, or you can say it is induced. Spontaneous or induced, right? Induced. Spontaneous is basically natural. It is basically natural. There may be a lot of causes, chromosomal anomalies, hormonal disturbance, right? Anatomical, structural defects. A lot of causes are there, and most of the abortions are spontaneous, right? That is fine. Induced. When you see induced, you can either be two of it. It can be of two types. Number one, it can be done as per MTP Act. You can say legal abortion. When do you say legal abortion? When it is done as per the provisions of MTP Act. Then it can also be illegal abortion. Illegal abortion, right? When will you say it is illegal abortion? When any abortion is done outside the purview of MTP, then you can call it as illegal abortion, and this is also termed as criminal abortion. Illegal abortion, also called as criminal abortion, right? When this abortion is not as per any of the provisions of MTP, then you can call it as criminal abortion. Maybe when the abortion is done by an unqualified person, it is criminal abortion. Maybe the abortion is done in a non-authorized place. It has to be done in an authorized place, right? Or when the abortion is done outside the duration permitted by the MTP Act, right? That is also illegal abortion or criminal abortion. Or when it is done without the consent of the person, without the consent of the pregnant woman, then also you can call it as criminal. All these conditions will basically call it as criminal abortion. Now we'll have to discuss the most important one, that is your MTP Act, right? MTP Act, which was in 1971, and latest last year you had MTP Amendment Act, MTP Amendment Act 2021, right? So let us learn both. Let's merge and let's see this MTP Act provisions, right, with combining everything together, so that it will be easy for us to learn. Basically, what are the indications of MTP? What are the indications of MTP? It is same thing. Number one, therapeutic. When the continuation of pregnancy is going to produce grave risk to the life of the mother. When there is a grave risk, continuation of pregnancy, it is posing grave risk to the life of the mother, then you can say you can do termination. Basically, maternal disease, any severe eclampsia or any other condition where it is providing grave injury or grave risk to the life of the mother, you can do MTP, right? Okay. The next indication is eugenic. What is this eugenic? Any risk of genetic disease. If there is any risk of severe physical or mental deformity to the baby, to the fetus. Deformity. Can say the mother was exposed to touch infection, mother was exposed to radiation, mother was having exposure to any teratogenic drugs, then there is a risk of deformities to the baby. You can do termination, right? And the third thing is social. What is that social? You can see this social is basically failure of contraception. Failure of contraception. That is social cause, right? The continuation of such pregnancy will cause mental agony to the mother, so you have to do MTP. And the last one is humanitarian, right? Humanitarian. What is that? Humanitarian grounds. If the pregnancy is due to the result of rape, right, you can do MTP. These are all the four indications under which we can do MTP. But as this is the same thing as per 1971 Act, so let us learn about what is changed here related to the duration. Let us say this is the duration of pregnancy, right? So this is term. Let us say this is 20 weeks and this is 24 weeks. 24 weeks and term. If the duration of the gestation is less than 20 weeks, if it is less than 20 weeks, one doctor is enough to do MTP. One doctor opinion is enough to do MTP. If the duration of pregnancy is beyond 20 weeks, 20 to 24, in this situation, you need the opinion of two doctors, right? Can you do MTP after 24 weeks? Is it possible as per MTP Act? right? Many of the students will say no. You can do MTP even after 24 weeks of pregnancy, provided you get the approval from the medical board, right? If you are able to get the approval from the medical board, then you can do MTP even after 24 weeks, right? Now let us see what are the grounds for conducting MTP within this specified period. If it is less than 20 weeks, you can see failure of contraception. All cases, including failure of contraception, right? Including failure of contraception, all cases. But if it's beyond 20 weeks, failure of contraception, you cannot do termination. You cannot do MTP if the pregnancy is due to social cause. Cannot do it. Between 20 to 24 weeks, as per the rules of MTP, the latest given rules, updated rules of MTP, you cannot do MTP between 20 to 24 in all the cases. Not possible. There are only specified cases where you can do MTP. What are they? Number 1, right? If the pregnancy is due to the result of rape, or if the pregnancy is due to the result of incest, if the pregnant girl is a minor, right? If the pregnant girl is mentally ill, you can say insane or mentally ill. Ideally, we should use the word mentally ill. We should not use the word insane, right? As per the latest Mental Health Care Act, we should not use the word insane. We should use the word mentally ill, right? Like we are physically ill, they are mentally ill, right? Or you can see in case of mass disaster times, she is not able to come to the hospital within 20 weeks. She is coming little after that. You can do MTP. You cannot refuse, right? Or if there is any marital status change. What is it? Marital status change, right? Marital status changed means if she has become a widow due to unfortunate incident, the husband died due to some accident, or she got divorced, legally divorced, then you can do MTP between 20 to 24, including fetal anomaly, substantial fetal anomaly. So these are all the situations where you can do MTP between 20 to 24. It is very, very important. Very, very important that you need to know this. Fine. Right? Fine. So this is very, very important. Rape, incest, minor, mentally ill, mass disaster times, and if there is a marital changes, status change, and last one is substantial fetal anomaly. If it is more than 24 weeks, you also have to get the approval from the medical board. You can do MTP in only one situation, that is substantial fetal anomaly, right? Where there is significant fetal anomaly. Whether it is significant or not, that will be decided by the medical board. When the medical board is approving, you can go ahead with the termination, no issues. But there is one situation where irrespective of the duration, you can do MTP. What is that? Irrespective of the duration, you can do MTP. There is no restriction for you. What is that? It is in case of emergency situation wherein you are going to save the life of the mother. There is no restriction with regard to duration. You're going to save the life of the mother. You can do MTP, no problem at all. Right? No problem at all. Because it is about the life of the mother. Suppose when she met with an accident, there is injury to the abdomen, right? And there is an injury to the uterus as well. You need to do termination. You need to save the life of the mother. So that is important. Highly, highly essential. So I told you about the different conditions where we can do MTP, that is medical termination of pregnancy, between 20 weeks to 24 weeks. How to remember this? To remember this, I'll give you easy way to remember. You can just remember. You see, this is what we have discuss now. I'll tell you how to remember this easy way. You can remember the mnemonic midwifer, right? Midwifer, right? You know midwife, right? So you can remember midwifer. So there's a little modification on it so that you will remember all the conditions. The first one, M, that refers to minors, age less than 12 years. Age less than 18 years, right? The letter I, it refers to incest, right? D for divorce, if the woman got divorced during this period, or in case of any kind of mass disaster, I told you, right? W for widow. I told you, no, there is a marital status change. Either the pregnant female becomes a widow, or it is she got divorced. And the next letter I, that is basically insane, mentally ill, right? F for fetal anomaly. Fetal anomaly, you can do MTP beyond 20 weeks, right? Basically, fetal anomaly, you can do MTP in all the period, right? If it is less than 20 weeks, one doctor, 24 weeks, two doctor. If it is more than 24 weeks, you need the approval of the medical board. That's it, right? And R for rape. Just do remember this mnemonic. You will be able to recollect all the conditions. You can do MTP after 20 weeks, but less than 24 weeks in your examination. Okay, so remember midwife. Right. So we have discussed situations when you have to do termination. This is about the duration when. Now we'll see about where you want to do it. You can do MTP only in case of authorized institutions. Right? It can be in semi-government, it can be in private, it can be in government hospitals, any hospital, government, private. Basically, it is in authorized institutions. Only in authorized institutions you can do it. Otherwise, you should not do it. That itself is an offense. Right? We have seen when, we have seen where. Then now we have to see who can do it. Who is eligible to do this termination? Who is eligible to do termination? See, if the registered medical practitioner, right, the person has to be obviously registered medical practitioner. If the registered medical practitioner is holding a degree, right, if the person is holding a diploma or a degree in OBG, they are eligible to do MTP. Fine. Then if the person has got 6 months internship, right, in OBG, they can do MTP, right? And if the person has got 1 year, right, 1 year, not 1 hour, 1 year experience in OBG, the person, that registered medical practitioner, are eligible to do MTP. And not only that, earlier, if the person has assisted 25 cases of MTP, out of which 5 cases done independently, then this person, right, this registered medical practitioner is eligible to do MTP, right? 5 cases independently, then this registered medical practitioner can do MTP. Earlier, this person can do MTP only up to a period of gestation, 12 weeks of pregnancy, not beyond that. Right? So I've told you when it has to be done. I've told you where it has to be done. I told you who has to do it. Everything I told you. As per the latest Amendment Act, they have also given one provision regarding confidentiality. You need to keep all the patient information confidential. You are not supposed to breach it. You are not supposed to disclose it. Violation is punishable. Don't worry about the punishment and all. But do remember, this violation of confidentiality is punishable. That is highly important. You are not supposed to disclose it to unauthorized person. Now, what about consent? See, medical termination of pregnancy, we already read that for all minor procedures, for just physical examination, 12 is sufficient. When it is any major procedure, the minimum age is 18. Termination of pregnancy is obviously a major procedure. You can remember the minimum age of the person to give consent for this procedure, it is 18. Do remember, this is one very important point. You have gotten so many questions with this one point itself. Right? Fine. 14-year-old girl coming with pregnancy, asking for MTP. You can do MTP, right? Which of the following is false? You can do MTP with the consent of the pregnant female. That is wrong, because she is only 14 years. You cannot do MTP with her consent. You need to get the consent of the guardian, right? In case of a minor, you need to get the consent of the guardian. That is very important, right? Have this concept in mind, right, very strongly, that you may get lot of questions in different permutation combination in the same concept. You need to understand the concept so that you will be able to answer all the questions in that particular area, right? And what about the husbands, right? Do you need the consent of the husband? Consent of the husband is not needed. You can go ahead with the procedure, right? Only for artificial insemination, you need the consent of the both husband and wife, right? For termination, for medical termination, it is not needed. It is not needed. Maintenance of the record, all the records have to be maintained for at least 5 calendar years. 5 years you need to maintain. And every month, monthly reporting should be submitted. Monthly reporting should be submitted to the CMO, the district. Right? So that is important. Monthly reporting should be done, but you need to have the records maintained for at least 5 years. So we were discussing about the legal abortion, that is MTP. Now we'll discuss about the criminal abortion. I told you criminal abortion is basically, this criminal abortion is called illegal abortion. Let us look at the different methods of criminal abortion. There are a lot of types are there. You can see abortifacient drugs, giving abortifacient drugs by means of general violence, by means of local violence. So there are 3 basic categories. You can see that for general violence. General violence is what they use, have violent exercises, right? Or cupping. What is it, cupping? They will have one candle, they'll keep it in the, they'll light it, they'll keep it in the abdomen, they'll have one cup just kept over this candle. What happens is when this light is, when the candle is, flame is there, it is keeping on using the oxygen. The entire oxygen is used up, it creates a vacuum which is holding the cup tightly onto the abdominal wall. What happens is when this vacuum is tightly holding the cup in the abdominal wall, they will violently pull the cup upwards, right? They'll violently pull the cup so that it causes separations of the membrane. It causes separation of the membrane. It may cause abortion. That is another method. That's called cupping, right? Fine. And we have genital gastrointestinal irritants, right? Castor, calotropin is commonly used. They are GUT irritants. They commonly use ergot and all for GUT irritants, right? Metals, right? Lead oleate is commonly used. Right? Ecbolic. This is important for examination purpose. Any drug which increases the uterine contraction, we call it as ecbolics. Any drug which increases the uterine contraction, that is called ecbolics. Any drugs which increases the menstrual blood flow and causes abortion, we call it as emmenagogues. Right? When it is increasing the contraction, we call it as ecbolic. When it is increasing the menstrual blood flow, that is called emmenagogue. What are the ecbolics? Examples of ecbolics. You can say quinine. Right? You can see estrogen. Right? You can also say ergot will increase uterine contraction. And what about emmenagogues? You can see borax. You can see estrogen. Right? You can see savin, that is sanguinarine. Right? So these are all the different emmenagogues. You can remember BOS, right? Borax, estrogen, savin, and sanguinarine. Just know the terminology, ecbolics and emmenagogues. Local violence. What is a local violence? They can either cause syringing. Syringing is, earlier they were using some Higginson syringe wherein that they will pump this soap water into the uterine cavity. It will cause abortion. Right? Abortion stick. They use any metal or any kind of pencil, pen, the tip of the umbrella, all these things inserted. Right? It will cause rupture of the membrane. It can cause abortion. Abortion stick, basically they use calotropin stick and all. Any irritant, plant irritant is commonly used for abortion stick, which may cause increased uterine contraction, that might cause criminal abortion. Dilatation of cervix, so that is also being done. Right? All these are local violences which can cause criminal abortion. That is what you need to do. And dilatation of cervix, they have what is called slippery embark. Right? That is basically a bark which is kept near the cervix, which attracts moisture. It keeps on dilating the cervix. Fine? Okay. Now the point is, what is so important here is the methods of criminal abortion. You just need to have a basic idea. It is not so important for MCQ purposes, but what is so important is you need to know what are the sections, legal sections punishing this criminal abortion. Legal sections, punishment for criminal abortion. What are the legal sections associated with that? We'll discuss. Number 1, 312 IPC. 312. Right? If the criminal abortion is legally, it is called as voluntary miscarriage. Miscarriage. If the voluntary miscarriage is done with the consent of the female, consent of the pregnant female, then it is punishable under 312 IPC. If the child is quickening, right? Quickened child, more punishment will be given. But the section is same. If it is done with the consent of the pregnant female, it is 312 IPC. Right? If the voluntary miscarriage is done without the consent of the female, then it is punishable under 313 IPC. And we also have 314 IPC, voluntary miscarriage resulting in death of the female. Due to some complication, it resulted in death of the female. She has come to the hospital doctor asking for abortion, right? You are doing illegal abortion, that is 312 IPC. She is also punishable, the doctor is also punishable. Right? And she is not interested in having the abortion, but the relatives are forcing her to have it aborted. Right? She was forced without the consent, abortion was done. It is 313 IPC. Right? The person who has done it will be punishable. The person who forced her will also be punishable. Right? Criminal abortion, if she was undergoing criminal abortion that resulted in complication resulting in death of the female, then obviously the person who has done it will be punishable. If she was forced, that person will also be punishable. 312 IPC, 313 IPC, 314 IPC. It's so easy to remember: with consent, without consent, death. 312, 313, 14. It's very, very simple to remember.